Good morning, everyone. It's a real pleasure for me to be here with you all this morning. And first of all, I just want to say congratulations on your work. I think it's very impressive to have started 10 years ago and to be here today with an opportunity for people across our state to improve the quality of care to young Oregonians. I want to share with you, as Director of the Oregon Health Authority, one of my privileges is to work with people who first provide Medicaid services to 1.1 million Oregonians. 25% of the state of Oregon is served by Medicaid, and that's good news in the sense that we're up to about 98% enrollment for children. It's sobering news from the standpoint that 25% of our population is vulnerable enough economically to yeah, thanks. To need Medicaid and to rely on Medicaid for their care. And then the other big part of our mission is services, public health services to the 3.9 million Oregonians across our state. And that's kind of unique for Oregon because in most states there's an agency that deals with Medicaid and there's an agency that deals with public health. And in Oregon, because of our vision and because we are all pioneers in our spirit, we did it differently so that we could integrate those two efforts to the benefit of our citizens. And we're going to talk about that a little bit this morning. I want to give you some basic information. First of all, over half the children born in Oregon today are born onto Medicaid. So that's over 50% of the 48,000 children born every year are born onto Medicaid. And every morning when I get up and go to work and get on the freeway to come to Salem, I am driven by that statistic because as a fifth-generation Oregonian, I find that very, very discouraging. We have to do better by our children in this state. And we have to begin that by doing better with our youngest children in the state. And even as a person who grew up in the 60s and 70s, we have to do better with contraception in our state. We have a growing number of children with a heightening level of need, and if we are not planful and strategic in our thinking and our actions, we will simply overwhelm ourselves with the need of young children. And so, as sobering as that is, I think the good news is that increasingly there are more and more people who understand that we have to get way upstream. We have to get all the way upstream to contraception. We have to get all the way upstream to understand that those first 3 years of life are absolutely critical and that we need to bring everything that we have in this room and in other settings to ensure that those children get what they need in order to have a successful life. And when I say successful, I often like to refer to, we just finished a 7-city tour talking to people who are in the mental health system throughout Oregon. Not talking to their providers or their therapists or their doctors, but talking to them. And the most compelling thing we learned, some of us who have worked in mental health for over a decade were not surprised, but the critical thing we learned is those people, the most frequently expressed concern was, I'm a person, I'd like to have the things that the people around me have. I'd like to have people in my life who are not paid to be there. I'd like to have a job. I'd like to have some place to go for Thanksgiving dinner. So I take mental health very seriously as we look out at the landscape in Oregon and we look at what our requirement is to ensure that we are providing not only the supports we need, but are also thinking proactively about how we address the youngest in our population. Currently, there are 132,000 children every year, ages 0 to 5, who if they do not get the appropriate intervention, such as the work you all are doing, they will never enter the workforce. They will never be employed. They may go to prison simply because of misunderstanding and lack of services. So 132,000 kiddos every day are looking at the adults and saying, we need your help. And part of what you're doing today is providing that very critical help. I'd like to first acknowledge the hard work of the Oregon Infant Mental Health Association, more than 300 members statewide working tirelessly to create this endorsement is just awesome to me. And when I first heard about it, when you invited me to come, was really the first exposure I'd had, and so I did what everyone does and kind of got a bunch of information on it. And I was very, very excited to see what you've been able to accomplish and what your plans are for the future. Together, we can collaborate between the state and private foundations and nonprofits and bring quality, innovative, evidence-based programs forward to benefit the families in our state. Now, the Infant Mental Health Initiative, as you know, was developed in the state of Michigan, and that was another reason I was excited to join you today, because part of the way we're trying to accelerate improved health care throughout our state is not by reinventing the wheel, but instead looking out to best practice, grabbing it and bringing it back to Oregon and executing it and implementing it with rigor. And that's exactly what you're doing. So I want to give you great credit for wanting to kickstart this effort by finding a best practice model and bringing it to Oregon and implementing it. This endorsement program has long been desired in Oregon to improve the skills of early childhood providers. One of the things that has been intriguing to me since I had a child, and my child's now 34 years old and a parent himself, but one of the things that I have always been struck by as a parent who accessed daycare, when I accessed daycare in Portland, there were 2 daycare centers in Portland, that was it. But one of the things I was always amazed by was child care providers and the incredible work they do. I don't think I could have parented successfully. I had great parents. I had a great family. My parents taught me a lot. But every day, as someone who was using daycare, I learned from child care providers. I worshiped the ground they walked on. I was sure that they knew more about the next developmental stage for my child than I knew myself. And so I'm very impressed and excited by the fact that you are doing something concrete and measurably to improve child care providers and their status in our society, because it's critical that we do that. For people who have not had the opportunity, I tell people all the time, have you ever worked with a child care provider? And frankly, there are a lot of people who haven't. There's a lot of men who have never worked with child care providers. And I encourage people to go spend time with them and understand the depth and competency of their work. As a member of the Early Learning Council since 2011, one of the things we have consistently focused on is the need for greater skill building and education for child care providers. You're doing that work. I need to say thank you to you for doing that work, and it is absolutely the critical work to improving the condition of children in Oregon. I know, thank you for thanking OHA for the grant. I want to give a shout out to Kate Wilcox, who's here with us today. Kate, would you please stand up from our Public Health Division? It is my privilege to work with Kate on a daily basis on early learning needs, and she's done an outstanding job, and we're very much thrilled to be an investor in what you're going to accomplish here. The endorsement verifies an applicant has attained a level of education as specified, participated in specialized in-service trainings, worked with guidance from mentors or supervisors, and acquired knowledge to promote the delivery of high-quality, culturally appropriate services and relationship-focused services. Doing this work in that way does 2 things, and one I know you're aware of. As we talked about, it raises the visibility and the credibility and the standing that we give in our society to child care providers, and that is long overdue. The other thing you're doing, though, which is dear to my heart, is we don't talk about mental health enough in this state and in this country. And I'm not a clinician, but I have spent 13 years of my life committed to children with acute mental health challenges. And so one of my commitments, and one of my commitments as director of the Oregon Health Authority, and you are supporting us in this work, is we need to talk about it. We need to be able to say that mental health is not something that is not understood and can never be addressed and is, as one Oregon legislator famously said, it's just a quagmire. Mental health is just a quagmire. Well, it's not. And we know from direct experience, from research, from the work of people like you, that if we identify mental health challenges early, if we take a holistic approach as opposed to a pathological approach, if we look at the whole person, if we look at the whole infant, if we look at the whole system that infant is living in, we can make great strides in ensuring that mental health is not a barrier to having a high quality life. And part of what you're doing by taking on this initiative is saying to people very clearly, we're going to give credit to the people doing this work. We're going to use evidence-based practices, but equally important, we're going to talk about mental health. I was in New York when Sandy Hook happened, and one of the things, I was there on business, but one of the things that struck me right out of the chute is how many times are we going to have circumstances like this happen in this country before we start talking about mental health and all the symptoms and all the evidence and all the preventative measures that we can take to ensure that children and families have the tools and resources they need to improve the quality of mental health. In our state, we are about to undertake something called a behavioral health collaborative. And one of the things I'm going to be talking about in that process, which will be a statewide process focused on behavioral health, which includes drug and alcohol addiction as well as mental health. One of the things I'm going to be talking about is the work you're doing in this room. Because the more we can collaborate, communicate, and improve the credentialing and credibility of people in this space, particularly in the mental health field, the better our outcomes will be. Right now in this country, 1 in 5 children have a serious emotional disorder. The work you're doing is profound in terms of reducing that number, and more important than any of the numbers and the metrics, and they're very important. More important is any child with a mental health issue deserves our tendencies or exposures, trauma, etc. Any child deserves everything we've got to support them in having a productive life. It's simply not good enough to just stigmatize, categorize, ignore, or set it aside. And we can do the work. No one knows that better than you. So we look forward at the Oregon Health Authority to joining you in this work. I was just having a conversation about how the coordinated care organizations, which serve about 95% of the need at the most vulnerable level in Oregon, we are working hard with them to expand the payment mechanisms that allow them to purchase. We're moving away from fee-for-service so that they can buy services that help prevent long-term health consequences. So we're working with them. We'll be working with you. But first of all, I just want you all to congratulate yourself on a great launch, on a great focus, and a great effort here. We could not be more excited about what the future holds due to your efforts. Thank you.